Prior to the COVID-19 pandemic, there was an ongoing opioid overdose pandemic that was really fueled by the addition of fentanyl to the opioid and heroin supply. And what we unfortunately saw in 2020 was a large increase in the overdose rate because both the pandemic, the COVID-19 pandemic, which really limited people's connection to recovery services and treatment, kind of collided with the already severe opioid overdose epidemic. So people who needed the help were experiencing the same anxiety and isolation that we were all experiencing, but then they were not able to link to services as effectively, and they were not able to have that structure, that accountability that people in early recovery needed. For the opioid epidemic, the timing was particularly, the kind of collision of the two epidemics was particularly painful. Rochester Regional never closed its doors during COVID, even during the peak of it in April and May of 2020. We always were available for walk-ins and on-site visits for people who were struggling. We maintained both in-person and Zoom and telephonic-only groups. We maintained in-person and telephonic one-on-ones, and those are all still available. Our residential services stayed running and open the entire time out of absolute necessity. Some of them and some of our partners in recovery treatment in Rochester needed to briefly close their doors at different times during the pandemic. We were really able to limit that, and we stayed open really the whole time with very brief pauses or exception. Behavioral health, and specifically chemical dependency, really requires that personal connection, and in the case of chemical dependency, requires the accountability that we can get by holding people accountable with urine toxicology screens. So in just converting to either telephonic or televideo care, we lost that ability to both connect with our clients and also give them that structure they needed. So I think there was a feeling of helplessness amongst myself and amongst the staff because we didn't know what was happening with our clients. We just had these phone call interactions, and we didn't have the ability to kind of connect them to other people in recovery and also actually have touch points with them in person, which is really important. What we're seeing is much less predictability in what the substances are people are using, and therefore people are presenting with fear, and people are presenting curious to see their toxicology results because they don't know what they're using. So that actually is a change that I think a lot of us have noticed over the last probably more 1 to 2 years, but it's definitely been more noticeable in the most recent months. And so I think people are there's definitely been more interest in finding Narcan kits, getting access to those. There's been more interest in seeing toxicology results, and more people fearful for what they've seen happen to a loved one or a friend or someone they've used with, and just overall fear about some of that unknown with what's going on with them, what they're using. There's lots of different ways for family members to be involved in their loved one's recovery. And also for them to get support, because I think we have to remember that it is a very difficult thing to navigate for family members who are watching this incredibly risky behavior, and sometimes watching their family member experience overdose and then maybe leave a hospital or an ED or a rehab clinic. It's very hard for them not to have feelings of profound helplessness and frustration. We can do conjoint visits with a family member and a client in the same visit right there. We can also engage family members aside from their loved ones. If their loved ones are in care, but the family member wants to pursue their own treatment in a way that is kind of independent and learning how to have those skills and how to navigate this complex relationship, we also are able to provide that service.